How do you know if your pain is from rheumatoid arthritis or just plain old aging? Hello, this is Dr. Siddharth Dambar, expert in rheumatology and regenerative medicine, physician here at Chicago Arthritis. Common question I get is, how does a person know whether the pain that they're suffering from is just plain old pain that comes from aging, or whether it's an autoimmune condition like rheumatoid arthritis? Let's talk about the differences. Aging-related pain can come from a few different things. The most common one is that a person has had some degree of stress on a joint or joints over time due to either prior stress, injury that's led to instability in the joint, and now progressive wear and tear arthritis in the joint. That can then lead to pain that's typically worse with activity and better with rest. Now, the thing is that pain with aging can come from other things as well. For example, very common, actually everybody, as you get older, your hormone levels start to change after the age of 40 or so. For men, lower testosterone level. For women, lower estrogen level. That's broadly speaking. But in both those cases, there is an increase in other symptoms that come with that, including pain sometimes. And then with aging, you're actually more prone to other types of autoimmune conditions, and that can include conditions like rheumatoid arthritis. But for the purposes of this video, when most people are asking, hey, I'm getting older, am I developing pains from getting older? Generally what they're talking about is that kind of wear and tear arthritis or osteoarthritis related pain. Again, typically worse with activity and better with rest. There can be some stiffness with wear and tear arthritis, but generally speaking, that morning stiffness or stiffness with activity will last for 5 to 15 minutes and generally goes away. On the other hand, pain that's coming from an autoimmune source, or what we would call inflammatory arthritis, conditions like rheumatoid arthritis or psoriatic arthritis, is classically pain that is worse with rest or first thing in the morning and better with activity. That's the real key difference. Those kind of conditions also have a lot of stiffness in the morning. And when I say a lot of stiffness, we're not talking about just for 5 or 15 minutes. We're talking for an hour, 4 hours, a whole day sometimes, where that stiffness first thing in the morning is profound. Their pain is dramatically worse first thing in the morning. And as the day goes on, they start to loosen up, limber up, and they feel better. As opposed to wear and tear arthritis, where a full day, they generally feel worse as the day goes on and toward the end of the day. So those are some of the key differences. Your rheumatologist or physician, if they're suspicious for one or the other, they'll likely be able to tell based on your examination, some other historical findings. Let's say you come in and you're saying, hey, I've got pain just in that one knee, more likely wear and tear arthritis. On the other hand, if you come in saying I've got pain and swelling in all the small joints of my hands, probably more likely rheumatoid arthritis. So historically, some examination findings, some lab findings looking for inflammation or any other kind of hormonal changes that you can see as you get older. And then, of course, imaging to help tell if there's more wear and tear arthritis or more inflammation can be helpful as well. Hope that was helpful. Any other questions about that, please let me know. Otherwise, if there's any other questions, check us out on our website, chicagoarthritis.com, or any of our social sites. Until we connect again, have a good day and live well. Bye-bye.